I had a 19-year-old girl come in today, and she had been diagnosed with thoracic outlet syndrome, which is something that everyone right now is dealing with. And a surgeon removed the first rib on one side of her rib cage to create more space for the nerves to flow through. Now, I have to tell you that I spent some time during that massage shedding tears for that girl. That surgeon would do that to her absolutely makes me irate. So muscles hold bones where they are. That can change. You can change the length of a muscle, and that will change how those muscles hold your skeletal system together. Now, all of these muscles, when they're tight, if you cannot get your fingers just a little bit underneath the clavicle or underneath it at the bottom of the clavicle, you need to change the length of those muscles in the front of your neck. That's really important for your posture. It's also really important that you breathe correctly. You breathe all day long, and that is the very best therapy you have for your skeletal system. Breathing so that you get the proper movement in your rib cage is so therapeutic. Your sternum should do what they call a pump handle motion. If you put your hand on your sternum, you should feel a little bit of lifting this direction. If you put your hands on your rib cage, you should feel a movement this direction. Your ribs need to move with each breath in those two ways. Now, if it doesn't, that doesn't mean it always won't. You can change that through intentional breathing. Now, a lot has been said about yoga breathing, where you breathe down deep into your abdomen, into your pelvis. That's great, as long as you finish that breath with rib cage movement. It's really important for your posture and your nervous system that you get that movement in your rib cage. Now, you can change your posture. Just because it's pinching nerves down your arm today doesn't mean that it's always going to do that. You have the power to change that. So do the therapies necessary to create space for the nerves to flow. That is within your power. You don't need to remove bones to create space for nerves. There's space. You can create it. So make sure that there is a balance of length, 360 around your neck. Make sure that there is a balance of strength in your pecs, in your lats, in your rhomboids, in your levator, in the anterior neck. Balance out length and strength, and nerves will have all the space they need to flow without creating numbness and pain.